Hard work.
Oh.
Not too much.
Welcome back. I'm Peggy. I'm an emergency medicine physician, and this is my husband.
I'm James, internal medicine.
And thank you for watching. Some of you might have joined in the middle of the season, but we are trying to get through the entire season of The Pitt. This last episode, if you haven't seen it, made me cry so much. James even shed a tear or two. We're reading
almost
all your...
as much as up.
I'm reading all your comments, so thank you so much for leaving your stories and your feedback. And one thing I did want to say was one of the comments from 2 episodes back was about, remember there was that case where the father was suspected of sexually abusing the daughter, and then they just kind of let them go. And one big oversight for the show that I didn't even realize in the moment, but it's totally true, is that physicians are mandated reporters of any child abuse that is suspected. So in this case, when it was suspected, social workers should have definitely got involved, and they should have definitely made enough report. So that was a big omission that is not like real life.
Mm-hmm.
Yeah, because that was a strong suspicion.
Yeah.
Here are my social medias. You can find me on Instagram and TikTok. And without further ado, let's get through this episode number 9.
Yay. 4 p.m. Almost time to go home.
I just want to hear his voice. How you doing, buddy?
Oh, he called his son.
Oh, after anything?
Because of the pediatric code, the last episode, the kid died. So
yeah, sad.
It's like the aftermath and how they feel afterwards.
Go home. That is the last place I want to be. You sure you shouldn't see your OB? I checked myself. Uterus is empty, barely spotting now. I'm fine.
She's having a miscarriage.
No, I remember.
What is that? Her little hair clip?
Aww.
We do these debriefs to try to give a sense of closure so that they won't linger. But trust me, the kids you'll lose will linger.
We got patients throwing punches and chairs.
Okay, everybody, let's get back to it.
It's true. We don't really have time to process things at work because things just keep happening. So it's hard to even get everyone in one room like that and debrief. I'm already shedding a tear. But yeah, so if we can, we try to debrief. Sometimes it has to happen after work. People are coming and going. Things are always happening. So it's just really hard to debrief, but important too. And I almost feel like this is my debrief because I don't get to do it at work. So talking about it here is almost therapeutic for me.
How hard is it to put a mask on your kid? Allergies!
Oh.
Hey! That's enough!
What happened to the tube? I think it's still in my hand.
Sure is. I hope you both have all your shots.
What do you mean, like vaccines?
Jesus, please don't stir this pot. Let's take these ladies back.
Vaccines don't stir the pot. We are pro-vaccines here.
Run around after run around. Hey, what's up, Eric Estrada? Still keeping your eye on me?
Always, my friend.
Crazy people.
We get all types of people every day. Get all types.
2 fracture into the dentin. Seal with dental cement. Prescription for Pen VK, soft diet, follow up with the dentist 1 to 3 days for a crown.
I have a lot of respect for dentists though, because I could handle amputations, but a tooth extraction just gets me. I cannot.
Yeah.
I cannot.
Once you do a few of them, I'm sure it's
ugh.
not that hard. That is not that hard, but once you do it a few times, you...
No, just watching, looking,
Oh.
it hurts my teeth.
Now that next time you keep your masks and opinions to yourself.
3 grams unison IV. Call the OR. Tell them we have a fight bite that needs to be washed out.
I mean, a fight bite, that is what we call it. It's just basically when you have an injury here from punching a human mouth. So, animal bites, dog bites, cat bites, they can all get infected. We need the antibiotics, but the worst kind are human bites, actually. Yeah. The most bacteria. And then if it goes into the joints, he's talking about the knuckle joint, then you would need an OR washout potentially with orthopedic surgery. But anyway, I mean, it's not an emergent thing. It's they stay in the hospital, they get IV antibiotics, and then we consult ortho. They can come in the next morning. It's fine.
Yeah, I was only running about antibiotics. That's good enough.
You want me to tell the surgeons to go no mask for surgery? Those of us who save lives for a living believe strongly that masks minimize risk. I want to respect your beliefs. So, with or without for surgery? Without?
I went with.
Good call.
Oh, totally called her out.
Yeah.
Called her out on the no mask. I still mask every single shift. I'm one of the more conservative, trying to protect myself because I don't want to get sick. I have young kids at home, so I am still masked.
Ultimate status and fever. Temp too high for a field thermometer?
We got to cool this lady down.
Get some ice packs, head, neck, groin.
Damn, core temp 107.3.
Where did they get all that ice? I didn't know there was that much ice.
Probably the cafeteria. Who knows where they got the
I
ice?
was like, I don't think
Yeah,
there's
maybe
much.
the cafeteria. I mean, I've never had to do an ice bath at work, but at certain events where you might see hyperthermia type patients more commonly, like you might be at a marathon or like out in the desert at an event, like for example, Burning Man or something like that, or a rave or something where people might be using an MDA, then I've seen ice baths out there. And like the number, like 107 temperature, that's like super high, right? Because it's like way higher than a normal fever. Often like a common myth is like, is there a number that when I hit that, like my brain will get fried and I must come to the hospital? There actually really isn't like a hard set number. I mean, 107 is crazy high. So yes, that's bad. But if you have like a 103 fever, 104, like, does that mean you automatically get brain damage? No, not necessarily. It depends on like why you're having the fever. If you're having a fever as a response to a viral infection, like for example, in a pediatric case, you just give them medicines for the fever if they respond appropriately, you know? So it's not necessarily the number of the fever, but really why they're having a fever. If they're having fever due to meningitis, then yes, that could be bad for your brain. But if it's a fever due to something more benign, then the number itself doesn't really worry us as doctors so much as why and how the patient looks when the fever, if they're able to control the fever. And then if you're talking about hyperthermia, like exposure to crazy high heats outside, or they're like in like a, you know, non-ventilated room, like older patients that are in non-ventilated rooms and like are just like overheating, that's different. Like, yes, you have to bring their temperature down and that is an emergency, but it's not so straightforward as this is the one number you must never go above.
1, 2, 3. Gentle, gentle, gentle. Houston, we have slush now. Look.
Feel bad for the actor.
For the what?
The actress.
Oh,
Yeah,
I don't know. I mean, people in real life do ice baths.
Yeah, but not toys still without making any.
I know.
That's
Hopefully it's a
impressive.
dummy after, like they put her in. I don't know.
Oh, you think it's a dummy? It looked pretty
Maybe
real.
like you know, switch out. Who knows?
Where your temp down?
They're pretty good dummies you can make.
That's
I don't know.
impressive. It's impressive that, I mean, it looks like a real human.
Exactly. Was she sweating?
So it's hard to tolerate an actual ice bath like this as a real patient. So usually they're like this, put into a medical coma, sedated so that they can just stay in there. And also you want them to be in a medical coma and like medically paralyzed so they're not shivering, because when you shiver, you're increasing your body temperature. So you want them paralyzed and sedated.
I wonder if it's fake ice, like, you know,
I'm
plastic.
Sure. Yeah, that's a good
And so
idea.
that's like
That's a good idea.
Hollywood magic.
Piece rubs on until after you.
It's a good idea.
What's wrong?
Oh man, we get unloaded.
Mouse isn't so bad. It's kind of cute.
That's a new thing for me. I've never seen mice in my ER.
I've seen roaches in the hospital.
No, 52, walking his dog in the crosswalk, got struck by a Chevy Impala at low velocity.
It's a cute doggy.
Yeah, it's a good dog.
Glad to be your hero. Sonny, you think you can find a milk bone for our little lifesaver here in the doctor's lounge?
Absolutely. I'll take good care
Why
of you.
are there milk bones in the doctor's lounge? That kind of stuff we don't have. But we do go crazy when cute animals come in, though.
Yeah.
We love it.
I can give you your first dose now, Piper, if you like. Get you started.
That'd be great.
Actually, I need Piper to answer that one.
Sure, that'd be great. Thank you both so much for your help.
Thanks.
In this situation, she's an adult, so whenever there's domestic violence or whatever, you just kind of give them resources and you can't make them do anything.
Yeah, they have capacity.
In the other episode, that was like a child. That's different. That needs to mandated to be reported.
Good news, Mr. Purnell. Your heart, lungs, and belly all look good.
Yeah, just the leg.
Woo!
Ouch.
That's not your road rash
Yeah.
record. We might have to bust out the tape.
I'll heal nicely though. Just need to keep it.
It's hard to clean that is the thing.
Yeah,
It's
that's true.
painful. Well, you can give them IV pain meds in the ER while you clean it.
No, she delivered a healthy baby here 10 days ago. Normal vaginal delivery, no complications.
So she's postpartum
Mhm.
and like altered, they said, because she was driving erratically.
Mm-hmm.
I was seen here this morning by Dr. McKay. Urinary tract infection. Discharged with oral antibiotics.
I need to talk to you about something.
Don't turn around and just watch Santa's. I told him not to turn around.
Can I come in?
Sorry.
Piper took a pen.
Pen is smart. I didn't know they had
It's a
those.
smart idea. Yeah, I
Smart.
didn't think of that.
Nice.
But now Everyone knows it. Well, anyone who watches the show knows
There are
about it.
literally hundreds of different MDMA pills.
Yeah, but the treatment that they're giving is like IV benzodiazepines. They're talking about Ativan. They're giving huge doses.
Yeah.
But actually, we talk about like toxicology, a lot of toxicology.
Febrile seizure? No, her temp is down. Maybe she needs more Ativan. No, she's had 20 already and the vitals are stabilized. Another form of Ativan and...
Yeah, more benzos.
This is a
And-
CNS problem. She needs saline. We don't have her labs back yet.
Hypernatremia.
For hours. You sweat, you drink gallons of water, but nobody thinks to replenish their salts. It's low sodium, hypernatremia. She needs 100 cc's of hot saline. Do it. And prep a gram of Pepra. Now.
Oh, she's thinking they have hyponatremia.
Hyponatremia from excess water intake.
Hyponatremia from drinking too much free water. So if you have too high or too low sodium, you can have seizures and be altered too.
Yeah, there's a lot of reported cases of this. Like MDMA, ecstasy makes you super thirsty. You just drink tons and tons and tons of water.
That you are a beginner, which means your job is to shut up, listen, and learn. Because so far today, the only thing you have been successful at is proving repeatedly that you know nothing.
Dr. Langdon, a word, please.
It's true. We can get reamed out for doing anything. I mean, in this case, she didn't do anything wrong, but not like in front of everybody.
Yeah.
It used to be like this, though. I think back in the day.
I think back in the day,
Back in the
it
day,
was
you
worse
could
than
get
this.
ripped a new one wherever, whenever by any attending or senior. But nowadays, I have memories of being brought to the supply room and getting yelled at, but not in front of everyone.
This kind of behavior will not be tolerated. I don't want to see it. You are senior leadership here. Step up and act like it.
It's the pecking order. Attending, senior, junior, residents, med students.
This poor guy. Dog.
Oh,
The cute dog.
Perfect job. It's practically a Zen exercise. I've got 1,000 pieces of gravel that need to be plucked out of a 2-foot-long road rash.
1,000?
She's so happy. It's like the exact type of thing like an attending or senior resident would not have time for, but a junior or a med student would have time to do.
Yeah.
Yeah.
Exactly.
That's a lot of gravel.
We could grab a coffee together sometime and could like help me lay up the land.
You asking him that?
No, what? No, I'm new here.
I don't date people in the workplace. It's nothing personal. It's never a good idea.
No, it's not a good idea. No, of course. No.
Don't shit where you eat.
Feel like I'm watching the rom com.
You're one to say don't shit where you eat.
I know, that's why ironic coming from me. I'm sure the viewers are smart enough to tell.
No, they don't know, but it's funny that scene happened in front of a patient too, because something about us is that we met while working together in a hospital.
Dude, paracentesis. Nothing like...
We were doing I was a med student. I was her, right? I was a med student, and you were a
intern,
junior resident intern, and you were teaching me how to do a medical procedure.
Yeah.
And we're there with the patient doing a long procedure. We have to wait around.
You basically stick the needle in, you just wait around for like a good 20, 30 minutes.
And we just
chatted it up.
Just chatted, and you didn't ask me out then.
No.
No.
I waited till the rotation was over. Because I too don't...
Because you do what?
I too don't date around.
He doesn't date in the workplace.
Until you're off service.
Until I'm not in the workplace.
That's the beauty of rotations.
So romantic.
Beauty of rotations.
But there's plenty of romance in the workplace, though.
Oh yeah, there
For
is.
sure, that happens. So yeah, that's how we met in the hospital.
My parents once took me skiing in Utah, and from the moment I got off the plane, I could not catch my breath, dizzy and panting. I was like a human in Utah.
Hey, I'm impressed that she asked somebody out.
Yeah, that's impressive.
She's got balls. I'm
Yeah,
impressed.
that's good.
You would say yes.
Yeah.
No, Paula, do you remember me? Look familiar. I was your doctor this morning for your bladder infection.
Still tachycardic 115, BP's 124 over 78.
There's no bleeding anywhere on the CT.
So blood pressure is normal, because I was thinking postpartum, elevated blood pressure altered. I think of eclampsia, but normal blood pressure.
And you people have done nothing to fucking help me.
Sir, you've got about 5 seconds to change your whole attitude before security and the police get involved.
We'll be leaving AMA against medical advice, accepting all risks of heart attack, stroke, disability, and death.
Yeah, it's hard to like know what's going on in the back when you're in the waiting room. I can't imagine. I mean, I've never had to wait in the waiting room for hours and hours and hours.
Yeah.
So I can imagine that would be hard, but it's true. Like that's exactly how the ER works. Is you have to triage them, and if more sick people come in, the people sitting out there have to wait even longer.
He's just waiting for lab, right? It's like, and the thing with troponins is you have to wait a certain amount of time.
Yeah,
it's
the heart enzyme blood test is like time sensitive. So.
Yeah, you have to allow time for the heart to basically develop it. So it's not like you can just like, oh, speed it up. It's not possible.
Right. But I think like, so the whole AMA form, it means against medical advice. And yes, it's something we deal with every day in the emergency department. It is something that you can choose to leave at any point. We can ask you to sign out against medical advice, AMA. In fact, you don't even need to sign it. You could just say, I'm leaving against medical advice. You could verbally say you agree to it, and then that's it too. I heard that actually, even with it signed, it doesn't like kind of release us of any liability still though. Like it's not like full like legal protection. For,
I don't know.
Yeah.
That's not for the doctors to figure out.
I mean, I don't know anything, but that I heard it's just like, just because we have it signed or not signed doesn't necessarily mean that like we're off the hook or not. But it is for us to overtly or just like to blatantly just state like, hey, we don't want you to leave and you're choosing to go against our advice, which you're allowed to decide, but we just have to make sure that it is known and clear.
Mm-hmm.
What's going on? Our crash Bishop Paula just went south.
ET's crashing 84/62, much less responsive.
Oh, that's the trauma lady postpartum.
Yeah.
This is the morphine?
She only got a small dose. Pulse ox is down to 89.
Set up for intubation and McKay, get Robbie in here.
Is it like she hands like water? What's that called? Watershed area where they like kind of get ischemia of that part, and then like hypo, like all the like the cortisone and everything's just like low. All the hormones are low.
Oh, pituitary, you mean?
What am I trying to say? What's it called? You know what I'm trying to say?
I know what you're trying to say.
But it happens in postpartum too, right?
Yeah, it can.
I don't know if she has some kind of adrenal insufficiency or something like that.
It could be. It'd be. How far out was she?
10 days.
I'm not sure.
What would cause her hypotensive and altered like that?
I don't know. CT is negative. Could be us.
I thought the CTs were normal.
They were. Systolics down to 70, heart rate's up to 130.
100 ketamine, 100 rock.
Is she a delayed bleeding?
It's not the chest, pericardium is still clear.
Is it a PE?
Could be PE.
Pulmonary embolism after
Doesn't really explain the altered mental status, and she's not hypoxic.
Pulmonary embolism could cause her to be hypotensive like that.
You would think that it's that bad. You would see something on echo, and you would see some hypoxia.
She wasn't hypoxic at all.
No. They said mildly tachypneic, but at least on the fake monitor, TV show monitor, it was like 18, so it's not that bad.
30 per kilo of LR and 4 antibiotics, ceftriaxone.
No, she was just in the hospital. Peptazo and Vanco.
Got it. This is sepsis. Where is it coming from? What's the source?
Urinary tract infection.
Retained products of septic. What's the thing called? What's a
retained products with conception?
Yeah, retained products, but then also septic. Like what's that?
Yeah,
called?
with just with sepsis.
Uteritis? No, what's the thing called? I'm trying to get the name of it. Yeah, there's like a I can't think of the word right now, but like
I know what you mean, but
yeah, the uterus is like maybe she's got retained products and she's septic from that.
Yeah.
So there's no nitrates, 0 WBCs.
Specimen could have been contaminated this morning.
Pneumonia? She was altered meningitis.
She's postpartum.
Endometritis.
Endometritis, that's the word I was trying to think of, yes.
I think we just blast them with antibiotics, right?
You still like I
But
guess
if
they're super sick, like you still probably just like an abscess or something to kind of clear it out.
Does a CT can you completely rule out POC with a CT scan? I thought you still have to do the transvag.
Yeah, ultrasound. Yeah.
Every postpartum patient needs a pelvic exam to rule out endometritis.
It was a quick chair exam. Are you saying I was biased against the patient because of her weight?
I raise it as a possibility.
That was a nice way to kind of point it out to her, though.
Yeah.
I mean, that'd be interesting. I would think more so being a patient in the chairs would bias me to be less likely to do a pelvic exam rather than the patient's size. More just like, it is like
walkie-talkie, she's fine.
Yeah, and it is more time and effort to get someone into a room undressed to do a pelvic exam rather than just talk to them and feel that outside the abdomen. Trust me, this is like a debate I have multiple times with other doctors. It's like whether or not you need to do a pelvic exam on someone with lower abdominal pain and UTI type symptoms. Like I have personally, I told you, I've personally caught like frank pus coming out of a uterus, like on like a story, and like not like a high risk patient. It was like an elderly woman, you know? So you would think like, why? And I don't think it's related at all to STIs. It's just like an infection that just happened, but it's like urine looked infected and all that stuff. And then I was like asking questions. I was like, well, let me make sure to do a pelvic exam. And it was very abnormal. You know what I mean? So
Wow.
it's important. That's why, and that's the story I used to be like, it's important to do pelvic exams in these types of patients. But the truth is, it's not probably practical to do it in every single patient when you, especially when you have like a room full of patients to take care of, and you just like the more likely option is that it is just a simple UTI.
Yeah, statistically, it's like way more likely.
But I guess in a postpartum patient, it's a good point to do an exam. Yeah.
You made it out unscathed this time.
Yeah. I'm joining the street team. Even got a jacket. So.
Uh-oh, no dating in the workplace. Oh, a doggy.
Oh, dog.
Oh yeah, terriers catch rats.
Perfect. Harvey, Grammarly. Come here. There you go.
Good doggy. Oh. Just killed him with his bare hands. Good dog.
Good dog.
Good doggy.
Hard at work?
Oh.
I'll take my chance.
Oh my God.
Gotta arrest that dude.
Oh my gosh. That's horrible.
Yeah.
I'm gonna cry again. But yeah, I worked with someone that was assaulted outside of work, but it happens in work too. And in our case, we lost somebody. That was really nice. So that was really triggering for me. Yeah, I was not expecting that. She was really nice. Assaulting healthcare workers is horrible. It's something like I have to keep an eye out for, that we worry about, that we tell people to watch out for. Especially when I was pregnant, I was like super like aware, like do not get close to anyone. Like I was trying to protect myself, like because all types of people come in and people can be out of it on drugs or psychotic or what for whatever reason can be just uncontrollable or unpredictable. And so sometimes it's kind of scary. Luckily, I work in places that some of the places I work with have metal detectors. It's still like anyone can walk in to your workplace or walk around your workplace or find you. So it is something that I do try to keep. I don't know, try to stay safe, try to be like a little bit more anonymous, like try not to be like, this is where I work, you know, like, or like, I don't know.
Just be like aware and just
be aware. But that was so sad. Like she was outside by herself too.
Yeah, that's crazy. I mean, something's gonna happen to that guy. Well, we knew something was gonna happen with that guy because he was just belligerent the whole time. Probably has some sort of personality disorder, or just a real jerk. And then,
I mean, with the whole United Healthcare thing, when people are upset and disgruntled about anything, but especially healthcare too.
You know, this is like a really nice like charge nurse. You know, like she didn't personally.
Yeah, but I think he attacked her because he felt that she was responsible for it.
I mean, she's just like one part of like a pretty inefficient system,
right?
But it's not like her fault.
Yeah, but he's taking it out on her.
Yeah.
All right, what's this? My tear on the keyboard? Thoughts on this episode?
Is it over already?
Yeah, it's over.
Oh, okay.
Yeah.
Not as bad as the last episode.
Not as bad as the last episode. I only shed
Less dark.
a tiny bit of tears.
Less dark. Less dark.
Yeah, less dark.
Only some punches being thrown. 2 punches being thrown.
Oh yeah, the fights in the beginning and the end.
Yeah.
Well, we are getting through this season. So far, we very much enjoyed watching it. We are super busy. Me trying to get him to sit down for this is hard. Then me trying to edit this is hard. I am not a professional video editor, but thank you for following along. I very much appreciate it. All the support for the time that I put into this. So the show is dramatized, like the yelling, the fighting. Hopefully that will never happen at my workplace. I might have seen it once or twice, but not like on a day-to-day basis. This is not a normal shift. But a good kind of way to show people that don't work in the ER, I guess, a little bit of what it might be like. And now people know how we met.
Yeah, it's true.
All right. Thanks, guys. Bye.